Baltimore General, an episodic medical drama. Written by Blue Bolton. Episode 1, Transfer of Care, Chapter 4. The antiseptic scent filled Emilia's nostrils as she scrubbed soap between her trembling fingers. Her eyes remained fixed downward, methodically counting to 20, a ritual ingrained since her first year of medical school. Jordan's life still hung by a thread, stabilized, but barely. He shouldn't have survived that, Shaw materialized beside her at the sink. Most wouldn't have. He's not out of the woods, Emilia replied, watching suds spiral down the drain from her wrists. No. Shaw's hands attacked her own skin, scrubbing with almost punitive force. But he made it off the table. That's something. Emilia stole a sideways glance. Deep lines etched the corners of Shaw's eyes. Her jaw muscles bunched beneath skin stretched taut with exhaustion. Conference room in 15, Shaw said, jabbing her elbow against the faucet. I want everyone's eyes on this case. Everyone? Everyone who matters. Shaw's hands disappeared into a paper towel with quick, efficient movements. Which now includes you, Doctor. Carter? The surgeon vanished before Emilia could respond, leaving nothing but the hiss of running water and the lingering smell of surgical soap. Voices bounced off the walls of the conference room as Emilia stepped through the doorway. Residents huddled in clusters, their faces illuminated by tablet screens as they traded theories in hushed tones. Shaw stood sentinel at the head of the table, arms locked across her chest, eyes scanning the room like searchlights. Carter, she called, nodding toward an empty chair. Sit. As Emilia slid into the seat, she caught the sidelong glances, felt the weight of curiosity pressing against her skin. First-day transfers didn't typically land in high-profile case discussions. Shaw cleared her throat once, and silence fell like a theater curtain. Jordan Hall, 16, presented with spontaneous epistaxis progressing to seizures and intracranial hemorrhage. No history of clotting disorders, no trauma, currently stabilized but critical in ICU. Her finger tapped a screen, and the boys' labs bloomed across the wall. CBC shows severe thrombocytopenia, platelets at 15,000 post-transfusion, PT and PTT both elevated. A young Latino doctor's hand rose into the air. Tox screen? Clean for recreational substances, Shaw replied. But he's on Vascotril for migraines. Started 3 weeks ago. The doctor's brow furrowed. Vascotril? That's a selective serotonin receptor agonist. Bleeding wouldn't be a typical side effect. And you are? Emilia asked. Dr. Alex Reyes, he answered, eyes meeting hers. Second-year surgical resident. Shaw continued. Doctor? Carter encountered a similar case at DC General. Patient also on Vascotril. Similar presentation. Poor outcome. The energy in the room shifted, chairs creaked, papers rustled, attention sharpened. Let's start with differentials, Shaw said. What are we looking at? Could be a GI bleed that triggered the cascade, called a voice from the back. Shaw's head swiveled. No evidence of blood in the gastric contents when we intubated. Seizure disorder presenting for the first time? Offered another doctor. Possible, Shaw conceded with a half nod, but doesn't explain the catastrophic platelet drop. What about poisoning? A woman with sharp features and a severe bun leaned forward. Rat poison contains warfarin, could cause similar symptoms. Good thinking, doctor. Salus, Shaw acknowledged, but the timeline doesn't fit. His mother's been with him continuously, and symptoms came on suddenly in public. Emilia's eyes traced the numbers and graphs illuminated on the wall. His fibrinogen levels are critically low. D-dimer elevated. This looks like DIC. Disseminated intravascular coagulation requires a trigger, Reyes countered. Sepsis, trauma, malignancy. Or an adverse drug reaction, Emilia replied, feeling the weight of her words settle in the room. The buzz of the fluorescent lights suddenly seemed deafening in the silence. You think Vascotril caused this? Salas's voice dripped with skepticism. I think it's a hell of a coincidence that two adolescents on the same medication developed the same life-threatening condition within months of each other, Emilia replied, holding the other woman's gaze. Shaw nodded. Carter's case at DC General died. The FDA investigation was inconclusive. Maybe they missed something, Emilia said. Or maybe it was just coincidence, Salas shot back. Correlation isn't causation. We learned that day one. True, Emilia acknowledged, but rare adverse reactions often go undetected in clinical trials, especially with newer drugs. Vascotril's been on the market for 18 months, Reyes interjected. If it were causing widespread bleeding events, we'd know by now. Unless the reaction is extremely rare, Emilia countered, or requires a specific genetic predisposition. Shaw's eyebrow arched upward. You're suggesting a pharmacogenetic interaction? It's possible. Some patients metabolize drugs differently based on genetic variations. If Jordan and my DC patient share a rare polymorphism ... That's a big leap, Salas cut in. We should consider more common explanations first. Like what? Shaw challenged. Salas's spine stiffened visibly. Undiagnosed leukemia could present this way. Or what about psychological factors? Shaw's face hardened into granite. You think he bled from his brain because he was sad, doctor? Salas? No, but then let's stick to medical science rather than psych consult territory. Emilia watched the exchange unfold, noting how Salas didn't shrink under Shaw's glare. The surgeon clearly harbored a particular distaste for psychological explanations. What about a rare clotting disorder? Emilia offered, steering the conversation back. Von Willebrand disease or Glanzmann thrombocythemia could be exacerbated by certain medications. Shaw's nod came slowly, deliberately. Worth investigating. I want a full coagulation panel and genetic testing. That'll take days, Reyes noted. Then we better start now, Shaw replied. In the meantime, we treat symptomatically and monitor closely. Emilia leaned in, elbows pressing against the table. We should also consider plasma exchange. If there's an antibody reaction to the drug ... That's aggressive treatment without a confirmed diagnosis, Salas objected. So is watching him bleed to death while we wait for lab results. Emilia fired back. The air thickened between them. Emilia felt each pair of eyes in the room like pinpricks against her skin, measuring, judging, evaluating the newcomer who dared to push. Shaw sliced through the tension. Carter has a point. I'd rather be aggressive than apologetic. Let's prep for possible plasma exchange if his condition deteriorates. Reyes's expression shifted, thoughtful. What if it's not the drug itself but an interaction? Vascotril combined with something else. His medication list is clean, Shaw said. Just Vascotril and occasional ibuprofen for breakthrough pain. Over-the-counter supplements? Reyes pressed. Herbal remedies? Mother says no, Shaw replied, but something flickered across her face. But it's worth asking again. People forget things under stress. Or they lie, Salas added, especially about things they don't think are real medicine. Emilia nodded. I'll talk to the mother again. Sometimes patients open up more to a new face. Good, Shaw said. Reyes, I want you to... The door swung open with a whisper of air. cutting Shaw's words short. A woman glided in silver-streaked hair, pulled into an immaculate chignon, her tailored suit creasing only where it was designed to. The room's atmosphere transformed instantly. Dr. Bird, Shaw acknowledged, her voice carefully neutral. Dr. Shaw. The woman's smile never reached her eyes. I heard we had an interesting case and a new addition to our team. Her gaze landed on Emilia like a spotlight. Dr. Emilia Carter, Shaw said, transferred from D.C. General, Dr. Ramona Bird, Chief of Staff. Emilia rose, extending her hand across the table. Pleasure to meet you, Dr. Bird. The pleasure is mine, Bird replied, her grip cool and firm. Your reputation precedes you. Excellent clinical skills, from what I hear. We're fortunate to have you join our Baltimore General family. The warmth in her voice rang hollow, like a script recited too many times. Emilia smiled anyway, her face muscles working automatically. Thank you. I'm excited to be here. And already in the thick of things, I see. Bird's eyes flicked to Jordan's data displayed on the wall. Fascinating case. Reminds me of something we saw a few years back. Shaw's shoulders pulled back almost imperceptibly. Does it? Bird hummed, noncommittal. Dr. Carter, I hope you'll join me for lunch later this week. I like to personally welcome all our new attending physicians. Of course, Emilia replied, even as her stomach clenched at the thought of being dissected over salad. Excellent, Bird addressed the room with authority. Don't let me interrupt. Carry on with your differential. I'm just observing. She claimed a chair at the far end of the table. The room's atmosphere crystallized. Backs straightened, voices lowered, the casual energy evaporating like alcohol on skin. Shaw reclaimed control with a clipped tone. As I was saying, we need to rule out coagulopathies and investigate potential drug interactions. Dr. Reyes, coordinate with hematology. Dr. Salas, review the literature for any reported adverse events with Vascatril. Should we contact the pharmaceutical company? Reyes asked. Not yet, Shaw replied. Let's gather our evidence first. Probably wise, Bird interjected. Pharmaceutical companies can be defensive when their products are questioned. Something in her inflection drew Emilia's gaze. Bird watched Shaw with an expression that lurked somewhere between warning and challenge. Speaking from experience? Shaw asked, her words lined with a razor's edge. Always, Bird replied smoothly, rising to her feet. Well, I won't take up any more of your time. Dr. Carter, welcome again. My office will be in touch about that lunch. The door clicked shut behind her, but the tension she'd brought remained, hanging in the air like smoke. Shaw waited a beat before continuing. Reyes, I also want you to check if there are any clinical trials involving Vascatril. Sometimes adverse events get buried in data noise. On it, Reyes nodded. What about the patient's neurological status? Emilia asked. Has he regained consciousness? Not yet, Shaw replied. Mercer has him in a medically induced coma to reduce intracranial pressure. We'll reassess in 24 hours. And if this is drug-related, Salas said, shouldn't we be reporting it? We will, Shaw assured her. Once we have something concrete to report, I'm not sending up flares based on suspicion alone. Unease crawled up Emilia's spine. Her DC case had been reported immediately, yet the investigation had evaporated into bureaucratic mist. Was Shaw suggesting something different or something familiar? In the meantime, Shaw continued, I want hourly neurochecks and coagulation panels every 4 hours. The slightest change in his condition, I want to know about it. The meeting disbanded, assignments scattered like seeds. As chairs scraped and bodies filtered out, Emilia gathered her notes, acutely aware of Shaw lingering nearby. "Thoughts?" Shaw asked when they were alone. Emilia weighed her words carefully. "I think there's more to this case than a random adverse reaction. Based on instinct and the similarities to my DC case, it's too specific, too rare to be coincidence." Shaw's eyes narrowed, studying her. "Your instincts brought you into my OR today. I'm inclined to trust them. But, but instinct needs evidence to back it up, especially when you're suggesting a medication that helps thousands might be killing some of them." Emilia nodded. "I understand. I'll focus on finding that evidence." "Good." Shaw collected her tablet. "And Carter?" "Yes." Bird's lunch invitations are mandatory, but her questions aren't. Remember that? Before Emilia could probe further, Shaw was gone, leaving her alone with the hum of the empty conference room, more questions than answers, and the distinct sensation of having waded into waters far deeper than she'd anticipated.